Sounds great.
Welcome. Sorry we're a little late. We're just flipping between the two webinars. My name is Corinne Waldow. I'm the Senior Director for Economic Vitality at the Boulder Chamber. And I want to thank you for joining us for this week's gym-specific webinar call. We wanted to make sure we clarify the gym rules, especially with the recent announcement that we will be moving to level orange, or what we called safer at home level 3 on Friday. So we will be moving through some epidemiological data, but also the information that you need to know about gyms as we move to level orange. As usual, I'm going to pass it off to Jesse Rounds and get you started.
Thanks, Corinne. And I will jump right in. So we'll go over the epidemiological data update. We'll do, I'm going to focus first on the universal gym fitness recreation center guidance that applies regardless of our dial status. Then I'm going to do a little bit on sick employees, and then we'll get into the state dial status and what that means. I just want to remind everyone, yes, we are heading towards level orange, what used to be level 3 on November 6th, which is Friday. So I will go over all those details as we go. So our 5-day average number of new cases, again, we're seeing a steady increase. It's picked up quite a bit over the last couple days, and so that's why we're in the situation we're in. We're also seeing this across our communities. It is hitting some communities much harder than others, but we're seeing it across the county, and I think that's an important detail. It's everywhere, and all of us are being impacted. In terms of this slide, in the past, I've shown the 18 to 22-year-old slide separately from the other age groups. This week, the data folks put them all on one slide, and I think it's really helpful to see that, we're not as in as bad a place as some of those spikes, which were incredibly high for the 18 to 22-year-old age group. But unfortunately, we're seeing an incredibly steep rise in new cases for all age groups, which is very concerning. And then the other big deal is hospitalizations. These are hospitalizations for Boulder County hospitals. That's not necessarily Boulder County residents, but they are in our hospitals, and we are seeing an increase, pretty significant increase. So in terms of our takeaways, case numbers are rising. Long-term care case numbers are rising. Our hospitalizations remain high and are increasing, and our positivity rates are increasing. So across the board, we're seeing not great information, and that's why we're being pushed to level orange. I should stop calling it level orange. High risk level. So moving on to gym recreation center guidance. This is really very basic. Please check the public health order for details on this, but really this is the gym and recreation center guidance, not capacity limits, but just what you need to do on a day-to-day basis. Maintain and enforce social distancing, discourage equipment sharing, disinfect equipment between uses, and all individuals must wear face covering. I put the asterisk there because of the whole, if you can take your mask down to catch your breath, or if you have a medical condition. But I also want to remind you that any business can provide alternatives to those who cannot or will not wear a mask. The state also, in the civil rights guidance, allows you as a business or facility to deny access to anyone, regardless of whether they have a medical condition or they just don't want to do it. We want you to provide alternative services, but you are not required to do that. The one thing I would say is read the civil rights guidance. It's very important to read that because it's a very protecting people's civil rights is very important. People have a right to use your services. However, to protect the larger public health, you have a right to say, we are not allowing people who won't wear a mask into the facility. Here are some alternatives, so on and so forth. So just want to clarify that. And I really, really want to emphasize mask wearing is an important part of this. So before we got the announcement, I had this slide in here that I think it's a really important important detail here. So gyms and recreation centers under yellow, which is level 2, which is where we've been, safer at home level 2, operate at 25% capacity, not to exceed 50 patrons, whichever is less, per room, indoors, or per activity or area outdoors. Under orange, which is where we are going on the 6th Friday, you may operate at 25% capacity, not to exceed 25 people. And again, it's a whichever is fewer situation. And again, it's per room. And this does not include staff members in rooms. And also, I didn't finish this sentence, I apologize. Organized recreational youth or adult league or adult sports must follow the guidance under red, which is that they are not allowed to operate indoors. They can go outside. If they're non-contact, they can have 10 or fewer people doing non-contact training. So that's an important detail. Organized recreational youth and adult leagues are not allowed indoors in any circumstances under orange, regardless of whether they're contact or non-contact. Jumping very quickly out of gym specific and getting into sick employees, I want to remind everyone that it's important to give sick employees the opportunity to isolate. If you have a single sick employee, you will probably not need to shut down. What we ask that you do is send the sick employee home, or allow them to stay home. Obviously, they need to go into isolation. You need to inform their fellow employees of possible exposure while maintaining the sick employee's confidentiality. There's HIPAA guidance. Speak with an HR professional. I know Corinne has provided a lot of help with access to that about protecting people's privacy. And then cleaning and disinfecting, you need to follow CDC guidance about how much to clean, when to clean, but you need to wait 24 hours at least before you clean a sick employee's work area. So for a probably sick employee, for someone who is exhibiting symptoms or has been exposed to someone, non-critical workers with recent exposure to a person with COVID-19 should be quarantined at home for 14 days. If they develop symptoms, they should get tested and begin isolation if they test positive. If they don't have symptoms, they can get tested. They should wait 7 days to get tested. And a negative test does not shorten quarantine. You have to quarantine for 14 days. Check with us if you have questions. There may be ways to continue to provide essential functions while quarantining people. So we can help with that. For workplace outbreaks, and this is when you've had 2 or more employees test positive in a 2-week period, you will be contacted by us, but it's also a good idea to go on the website and fill out the CDPHE COVID outbreak report form, send it to us, and we will be in touch. We'll walk through what needs to happen. You will likely need to close down for the day that you find out that you've had your second employee test positive. We will work with you to try to reopen as quickly as possible. What we want to do is make sure that we figure out who on your staff may have been exposed to those 2 people so that we can limit additional spread. And then we also want to make sure that the workspaces are clean. So those are our two goals there with the closure and sort of the reset. And like I said, your local public health authority, which is us, will work with you to try to get you back open as quickly as possible and safely. So moving on to the dial. The new dial does not have numbers. It has names and colors. Right now, before the 6th, we are at yellow, concern. But as of Friday, we'll be moving to orange or high risk. And the way that the state measures this, they use 3 metrics: our new case incidence per 100,000 over a 2-week period, our percent positivity over a 2-week period, and our hospitalizations over a 2-week period, whether they're stable or declining. These are charts that came out Monday night. Some of them have been updated since then, but I think the important thing here is as of Tuesday morning, Monday night, we were at 290, almost 296 cases per 100,000 over a 2-week period. That puts us in orange. Much of the rest of the metro area is in worse shape than that. Our 2-week testing positivity rate is still in a good situation. We're in yellow. We've actually been at 5 or below for most of the time that they've had the dial. So that is an increase and it's concerning. And then the hospitalization status, this has actually changed recently. Much of the Lane tells us that, told us in the last session that much of the metro area is now in red. We are not in red yet, but that is a concerning trend. And obviously with the amount of movement between communities, it is very hard for us to separate ourselves from the metro community or from the state as a whole. So these are important things. All these metrics are why, when looking at our situation, the state made the decision to move us to level 3 without asking us to go through a mitigation plan first. So burying the lead here, Boulder County will be at high risk or level 3 or orange on Friday, November 6th. All businesses will need to comply with high risk guidance. For gyms, that means, again, your operating capacity goes from 25% and 50 people to 25% or 25 people, whichever is fewer indoors per room. Outdoor classes are permitted at 10 or fewer participants. And then team sports, I left blank, I apologize. I must have moved this, but again, indoor team sports, as I said, are not permitted. And outdoor team sports can have non-contact training up to 10 people. And that's really about it. Just remaining is our pep talk. Require mask use, follow the state guidance, wear masks, wash your hands, and socially distance. And then in terms of other things we can do as a community, sign up for the exposure notification system. That's a great way for you to become aware if you have been exposed. It's also a great way for the community to track and trace as a whole. So again, today we had our general update session, and then we're doing our gyms and recreation centers now. And Corinne, I believe I get to announce now that we're going to have a session at 1 o'clock on Friday for additional questions. We weren't able to get to all the questions in our previous session, so if you do have more questions after this, if stuff comes up in the next couple days, please join us on Friday, and we're happy to answer more questions. There's also a Spanish language session that gets recorded on Wednesdays and is released Thursday. That's in cooperation with the Latino Chamber, and they are working with the same information we are, and we're also just as surprised to be moved to level 3 as we are. So, with that, I think happy to answer any questions.
Okay, some of these questions are really long, so it's going to take me a minute to read through them, but I'm going to get through some of, while you're answering some of the other ones, I'll read through them. Are children ages 11 and below required to wear masks now in Boulder County?
They are not. The mask order has not changed.
They are encouraged, but they are not required for the order.
For the Boulder County, are there municipalities that do require above a certain age though? Is Louisville a little bit stricter?
I think it's, yes, I think Louisville is different.
Yeah.
Okay.
So they should check with their municipality.
So we have a lot of gyms on the call who do indoor instruction, dance, tennis, gymnastics, those types of things. How is indoor instruction allowed, and how do they operate?
So indoor instruction is allowed, and they are allowed to operate at the capacity per room, 25% or 25 people.
So I think that's the key, is if you're doing indoor sort of training instruction, that is allowed. So the whole question of, well, what if it's training for a swim team or a hockey team? It's focused on training. I mean, but you can't have any sports happening indoors. So if you want to be compliant, just do training. And again, don't focus on it being a team. So
I think the other thing is that you can't have anything that happens indoors has to be socially distanced. So you have to be 6 feet. So you can have, like Lane, you're exactly right. You can have hockey practice, but you can't have contact. You have to figure out a way to keep people distant. And I think now more than ever, you need to get people to be wearing masks while they're together.
So, lessons can continue, those types of things can continue. It's just, the training aspect of it, and as we're moving into the winter, concentrating on the training aspect of it, and maybe less because you can't have the team sports or the organized sports.
The competition component or
okay.
The
So what about the gyms that have, massage or physical therapy or some of those limited healthcare or personal services within them where there is direct contact? How do they operate? Do they have to separate that out between personal services and gyms?
Yeah, the use to which you put the room is really what it comes down to. So, I know of, obviously there are some places that do, like you said, massage or have a business within their larger facility that's a separate business. Well, they have to follow those, the personal services guidance, which is actually the same as the gym guidance.
25% or 25. And then if you've got a retail component, you've got to follow the retail, which is also 25%. But the problem is just making sure there's not the intermixing of people, and you just have to keep track of your numbers as those different capacities mix together.
Exactly. And if you have multiple sectors in a building, each sector needs to follow their own guidance beyond the capacity. The same like with retail, cleaning spaces and making sure that that's clean. And with personal services, everybody needs to be wearing a mask. And if you have to do something where someone needs to remove a mask, the practitioner needs to be wearing a mask and a face shield. All those things are still in place.
So can non-team sports happen inside, like 4 people playing tennis or racquetball or, some of those indoor sports?
So that's an interesting question. We are reaching out to the state to clarify, but I would remind you that if you are gathering to play tennis or pickleball or something like that, where there's not contact, remember that is a group gathering at that point, and you can only have up to two households. So
then you fall under the personal gathering order because you're not a team organized sport. You're 4 people coming together, personal gathering, and the rule is 10 people from no more than 2 households.
Yep.
Same requirement falls under restaurants, kind of in a way that's like you're having a table of people. You really can't have more than 2 households in more than 10 people.
Yep. I have had, in speaking with a recreation center earlier today, I'm aware that they are doing things like renting out a half court to one household. And that's a way as a household, you can play basketball then. But otherwise, you can't play basketball because it's contact sport. At least the way
So I think we have somebody asking a question, the same question you guys are asking, which is you can have a gym of 25 people in one room, but you can only have 10 people outside in a field or a parking lot. So you explained that in the last webinar a little bit. Do you want to explain what some of the questions you're asking?
Well, I mean, yeah, exactly. So we are reaching out to the state to try to clarify that. You know, the change in the gym regulations were, if you remember about 2 weeks ago, this level, gyms and recreation centers needed to be closed. And that changed, but I'm not sure that they read the entire order closely to see that they were changing one part but not the other part. So we're reaching out to the state to see if they are confirming that the 10-person rule still holds for outside, because the way the order is written right now, if you're outside but next to the building in a courtyard, you can still have 25 people. But if you're on a field, you can only have 10 people.
So the question would clarify if you have an outdoor fitness class, 10 or 25 people, you just answered that, which is
if it's in a courtyard,
adjacent.
you're fine, but if it's in a field, in a park, it's 10, which
Okay.
That's confusing.
With social distancing, masks on it.
Yes, all that, yep.
Do you have to have 4 walls and a door to be considered a room?
Yes.
If there's notably different usage between the space, it needs to have 4 walls and a door?
4 walls and a door, and that is also true of the basketball courts. To make a half court a separate thing, it has to be a solid wall between the two.
So it can't be just a curtain or a non solid divider.
Right, a curtain would make that's still one room.
Would group exercise fall under personal gatherings, or is that fall under the gym order?
So if it's associated, if it's inside a gym, that's a personal service and that's personal training, and I think that would be the 25%. If it's for
if it's
example,
a yoga class, or
yoga class that's happening in a park, that's 10 people. Right now.
What if it's a yoga class or a dance class? That's
if it's happening indoors and it's led by an instructor, then that's personal training, and I would say that's the 25 people or 25%.
So we have a bunch of tennis league. We have a couple tennis leagues on here, and they're people that come together in leagues and they play tennis against each other. Sort of like a group lesson, sort of like those yoga or some other ways, but they're playing against each other. Where do they fall? Is that a team sport? Is that, a group lesson, or is that a personal gathering?
If it's a league, then it is not allowed. We are asking for clarification on this. Go ahead, Lane, sorry.
Outdoors it is.
Yep, outdoor, yep, sorry, yes, outdoors it is. Indoors, not allowed. We are looking for clarification on this. There are some facilities that I know are taking their leagues, and sort of what Lane was talking about with a hockey program or a basketball program. If you can call it a lesson, and there is and the same 4 people or 2 people play each other for the entire time, there's no changing partners or anything like that, that may be permitted. We're looking into that. But suffice to say, indoors, traditional sports, just assume they're not allowed.
And if it's they get rid of the word league, but it's the same people signing up on their own to administer this on their own, then they fall under the personal gathering rules, because they're coming together on their own to play tennis on their own, not as a lesson, not as a.
Then they're limited to 10 people from 2 households.
Okay. If there was a tennis instructor, would it be a group lesson?
If it was a tennis instructor, again, if it was a tennis instructor and everyone was playing tennis at the same time and didn't change sides, change teams, change anything, you might be able to get away with that. We're again asking that question. I don't know.
So the idea of a clinic, the idea of training and clinics and lessons, as opposed to leagues and.
Yep.
Okay. Well, so swim teams and indoor pools, no, but swim,
So
They can
actually,
train, they can't
uh,
compete.
go ahead, Lane. Sorry.
They can train indoors, they can't compete. There can't be
Exactly.
any competition.
And we
So-
are looking into the question of whether the capacity also changes the rules about how many people can be in a lane in a pool. So that's another question that's out there right now to be answered.
what is the best procedure if a patron tells you they tested positive, considering everyone is wearing masks at all times and are at least 6 feet physical distancing while at your facility?
I think I would have to know a lot more details about the space and things like that. And I don't want to speak in hypotheticals, but basically, if an individual on your staff spent more than 15 minutes with that individual in close proximity, they need to quarantine.
Yeah, the best thing to tell them is to reach out to public health, that we can then have one of our team do the assessment to determine if there's any high risk exposures. So you don't have to try to be that person and play that role.
All right. So in the last meeting, Jesse, you mentioned outdoor classes connected to a building could have 25. Where is the documentation? Is that in the order that I linked the
Yes,
order?
yeah.
The very first thing I put in the chat's the link to the order. It's 64 pages, but there is a, you can go down to the orange or high risk area. There's also appendices. There's a lot of the technicalities in there. And why is the outdoor cap lower than indoor? You kind of already covered that. And if people are distance outdoors, do they need to wear masks?
In Boulder County, if you can't maintain 6 feet of distance, you need to be wearing a mask outdoors.
Okay, if it's 4 walls and a door, does the door have to be closed?
Yes.
A hallway with no doors work?
No, I'm sorry. I don't mean to laugh. I'm trying to, I just saw a picture in my head of a room with no doors, and I thought it was going to be one of those questions about how you get out of it. But no, a hallway with no doors is not a room.
Okay, so they're not trying to put 25 additional people into that hallway area?
Yep.
Or maximum. So there's a question as to whether or not there can be a variance within a specific gym or business. So the question is whether someone could come out and look at their space, but the idea is that there aren't variances per business. This is a cross-county restriction. Everybody has to follow the same order. You guys aren't actually given the ability to give variances to businesses.
That's absolutely correct. Yeah.
And this order is coming down from the state. You were given a letter today by the state that says you must move to level orange, high risk.
Mm-hmm.
And it doesn't provide for any variances under this level.
What about a water polo team? Can they practice or just, could they play a game?
No, they can't play a game. And if they can practice without being in contact with each other and also wearing masks, then yes. Water polo is that's a unique one.
They can train, do a lot of training.
Yeah, I think they can do swimming training and
Yeah,
stuff without wearing a mask, but they can't be interacting and doing anything else.
Yeah.
No indoor sports.
Okay. Youth sport clinics, and so not leagues or not, but you bring youth basketball together where they each have their own ball, they don't share equipment, they maintain social distance, and they learn how to dribble, how to shoot. Those types of sports instructional clinics
if they're
are
wearing
allowed.
a mask and they can socially distance, then yes.
25.
So mask, social
25.
distance, no physical contact, no shared equipment. They're not playing a league. It's not organized sports, it's training.
Okay.
Any training, so of any kind, any sport can happen. You can't have any interaction between people, so you can't actually play the sport, but you can do any kind of training and skills and anything like that.
Did anything change on the locker room shower guidance besides just the social distancing, regular cleaning? Nothing changed on that?
Nothing changed on that.
Okay. Where do they find out how many kids can train in a swim lane?
We'll get back to you. I will. I'll let Corinne know as soon as I know, and we can put that out by email.
Yeah, I was looking to see if that was in the FAQ document, and I don't see it. I mean, the best advice we can give is maintain 6 feet of social distancing. So in that case, certainly one person per lane is probably your safest bet. But
And remember that for open swim, not swim team, right now even, you're not allowed to share more than 2 people in a lane unless they're in the same household. So that's still, that's been true all along.
Okay. Does CASA variant still allow sports football in Boulder County when?
So the state released a letter. I would reach out to CHASA or to, I can't say for sure exactly how it's written, but I do know that certain winter sports that are ongoing were given the right to continue at some level.
They need to apply for a variance or exception from CHASA or the state?
No. Basically, the governor's order accepted that like automatically. They don't need to apply for a variance.
So if it's a CHASA specific sport, that's operated there. Any other variance, and if this was a 2-part question, so I want to make sure we're clear. Variance and exceptions to the order that we're talking about right here, other than this CHASA, you can't apply for it. Boulder County is not accepting applications from youth sports leagues.
We are not allowed to accept applications.
there's no provisions for the state to support any variances, so we can't even put them forward.
And I would caution that what's happening with CHASA is not a variance. They are separated out as different kind of sport, and that's been since high school sports have been allowed. So I don't think it's a variance. I think it's an exception. It's sort of like schools are operating differently than other facilities.
And collegiate and pro sports have been pulled out into yet another category. So there's all these varying categories that it is challenging.
So the guidance was that you have 1 person in a swim lane for lap swim unless they're from the same household, and you can have 2. That hasn't changed at this time for open swim.
It has not.
What about towel service? We have staff that grab towels from bins, and to be honest, staff is a little scared of that. And I'm stating bring your own towels.
You're saying for cleaning the used towels?
Yeah.
It's not really a concern of risk really, but if they have anybody who's in sort of a janitorial or cleaning kind of role, they should already be taking some precautions, but yeah, if you have towels that are used and now need to be laundered, you should sort of minimize your exposure, but it's not our primary risk for COVID.
Okay, so now we're talking about that outdoor 10 person outdoor, not directly in your courtyard. Let's say it's a tennis court. Set of tennis courts. Is it 10 people per tennis court or 10 people for all 7 of those tennis courts that are right there?
Well, I don't know why you would put 10 people on a tennis court.
I'm just saying, I'm asking.
Yeah. I think that you still need to just maintain all the social distancing. So if you're doing training, and I guess that would be the reason whether it be more than 2 people on a side, they just need to be able to maintain social distancing. So it would start to have people running into each other if they're trying to do anything and have more than that. But the limits are really on the size of the overall group. So again, if this was an organized event that now you have 25 people kind of as your max for that sort of tennis tournament or whatever you want to call it, tennis class.
Is every county going to level 3, or wasn't Boulder County trending pretty well?
We've not been trending well. I think that was what Jesse kind of showed, is all of our trends are going up. So our positivity rate has been going up. Our 2-week case counts have been going up. We've seen increased hospitalizations. We're maybe better than some of our peers, but all of our trends are not favorable. I'm not sure what's happening with all the other counties. Adams County has already been moved as of last week. Jefferson County, I think, is in that process right now. Denver had already moved. I'm just seeing the numbers and kind of the others, like the trends are pretty bad. Actually, Weld County all the way to Pueblo is bad for hospitalizations. So I'm not sure what's going to happen with all the other counties, but likely very similar, I would expect.
I know there's some concerns, if you've got a neighboring county and they're at lesser restrictions, people might go to the gym on that county, or some of those. But we're seeing pretty similar trends on all the counties around us, and some restrictions, especially in the Adams, Denver, some of those, Jefferson, some of those counties, seeing similar numbers. So they're probably facing similar restrictions. Can personal gatherings exceed 10 people and 2 families if they're outdoors, or is it indoors and outdoors?
Indoors, outdoors, anytime.
So when you see those group parties in the neighborhood and it's a bunch of families sitting around, they're technically violating the public health order.
And that's likely some of the big drivers for disease is personal gatherings and people getting together with multiple households, not social distancing, not wearing masks. That is probably one of the biggest problems in the metro area, and it's causing a lot of disease.
Okay. So there's a question as to, why restaurants can, have 10 people sitting at a table without masks, and, gyms have these restrictions that they have. But there are some limitations now, especially the personal gathering order within within the restaurants. Some of those things are also being placed on restaurants as well, correct?
Yes.
Yeah, I think it's 8 maximum at a restaurant, and it can't be more than 2 households as well. It's not necessarily up to the restaurant to police that, but that is still the restriction.
And the difference between someone sitting down and having a meal and, talking at a table versus exercising and, breathing heavy or, without a mask on, there are some differences between the 2 industries as far as wearing a mask and not wearing a mask, as far as projection of particles beyond the 6 feet or within the 6 feet.
Yeah, there are definitely differences. And I think the other thing is that generally at a table, at a restaurant, you are probably with people and according to the orders, you should be people with people you're cohorting with. Whereas in a class, in a gym, there's no guarantee of that.
And both increased risk. So, but at the gym, they should be wearing a mask the whole time. And in the restaurant, when they're not masked, that increases our risk. So we recognize that. We're trying to manage risk with viability for businesses, and but as we get more restrictions, there are now more difficulty in allowing some of those higher risk activities.
So there was that question about the children 11 and under wearing masks, and the person wrote back and said the Colorado Office of Early Childhood Education issued an order Friday for all children 3 and above to wear masks. Is that within a certain situation or certain, and they said it was confirmed by the EPI team?
So we've been recommending that for a long time. It's not a law. There won't be any fine, penalty, jail time for a 5-year-old that's not wearing a mask. We would encourage the parents, though, to try to have those children in masks, but the order does not say that for a Boulder County order.
And would that be more, maybe this might have been under the childcare settings, maybe within the childcare settings, or since it came from the Carr Office of Early Childhood Education?
Yeah, so for childcare, I know that they're probably still also encouraging that to try to happen, and I'm not sure if that is a rule or not. But certainly parents should work with their childcare centers to follow the rules of that childcare center.
So how do you feel about a person in a small gym that is following capacity and wearing a shield and not a mask?
Shields are not a replacement for a mask.
It doesn't stop the droplets. A shield is meant to protect your face. It isn't protecting everybody from what's coming out of your mouth. So it doesn't serve the same purpose.
We get a question in our gymnasium. I'm the only person in this entire 10,000 square foot space. Why do I need to wear a mask?
If you're the only person in the building, you don't.
Right.
You're the
But
only
that's-
person in that 4 walls and a door.
Yep, exactly.
So, but if somebody else were to walk in, you need to make sure you're wearing a mask.
I mean, if you're there because you're the person opening up the place, you don't. But as soon as the place is open, you need to have a mask on before people come in.
So what about ceiling fans and wall fans in weight rooms that push droplets around sideways? And are there recommendations around fans within the gyms?
Yeah, the recommendation is not to have them.
Okay. It sounds like swimmers can train but not compete, and swim lessons can only do private or semi-private lessons with kids from the same household. But are you saying no group lessons because there are more than 2 households?
So,
No.
yeah,
Go
sorry,
ahead.
go ahead.
Go ahead. You got it. Sorry.
Yeah, so no, you can have a group lesson as long as everyone is socially distanced. An example came up today of swim lessons for kids who have a parent in the pool with them, so that they're the only 2 people who are interacting, and then there's an instructor on the pool deck. As long as the people in the pool are socially distanced and the instructor is socially distanced from them, that can go forward.
And you're maintaining your capacity limits.
Mm-hmm.
The difference that came up earlier was, let's say that they wanted to self-organize. They were a swim team and wanted to self-organize into their own swim team. That's when it moves into the personal,
Yep.
The personal convening order.
Yep.
I don't think little kids would self-organize into those, but I was just trying to translate it between the tennis and the swimming. So I don't know if this is a question. Oh, whoa, no fans? I thought we were supposed to have them on. What about air purifiers, heat,
So-
AC?
Yeah,
That's different.
it's different, and I also think like the fan thing is very confusing. If you have a fan that is at a doorway or a window that's pushing air, either fresh air in or pushing air out, that may be permitted. I would check with, I would look on the OSHA website. There was also a really great seminar done. Corinne, I don't know if I don't have a link.
I can resend out the HVAC webinar about HVAC systems and air circulation. So the recommendation was, fresh air, airflow, fresh airflow. I think the question that came in was about fans that push, in the weight rooms that push droplets within, onto each other.
Yep.
What you're saying is fans allow that airflow, but you might want to redirect them to push that air out, or there's still that airflow, there's still fresh air, there's still, people can put increased circulation.
Yeah.
Someone on here is now quoting the CDC that increased circulation of outdoor air as much as possible by opening windows and using fans. But what you were saying was not to have some of those overhead or fans that you sometimes see in gyms that are, pushing things in more in.
I think that's a great example, and Lena, you may have more experience with this, but I like my read on that from reading the guidance and from talking to people is the idea is if you're passing fresh air through a space, that's one thing. If you're just moving air around in a closed space, That's not helping anybody.
Yeah, and the idea with the fresh air intake is part of your HVAC system. So you really want to balance that. So just opening windows isn't necessarily helping anything, to be honest. So you really want to make sure that you're using the system, that it's balanced and that it's operating properly. So that's the bigger focus. But just sticking a fan in a room to cool people down because the air and their sweating will make them feel cooler, that's blowing air from one person's breathing zone into others. So that's not actually helping. So.
And then this healthcare provider on here also said they just be careful with the outdoor contaminants. If you're just opening a window to open a window, you might pose risk, safe or healthy risk to occupants who may have, like for the example, the fires recently, the outdoor air hasn't exactly been very good for our.
That's true. I think that, again, the key is your ventilation system. So it should be able to cool the space when it's too hot, should be able to warm the space, when it's too cold. But opening windows, you're imbalancing the system that was actually put in place. So for large buildings, that doesn't usually help by just opening a window in one space. So it's really making sure that system, that HVAC system, is operating properly.
And then there's a question about studies that show that wearing a moist, dirty mask might be more dangerous than not wearing one. And I know that one of either my yoga gym and my gym, they recommend that I bring 2 masks every time I come in, so that if I have a soiled or dirty or sweaty one, that I can immediately change it out.
Right.
And they have another one available to me if I happen to get it wet or soiled or dirty. Or
people should take breaks, if they're breathing too hard. So there's lots of new additions to all this, but it doesn't give the excuse of, well, now we don't have to wear masks at all because they get soiled. So you just need to have as many masks as you need and take breaks as you need to. It's the concession so that gyms can stay open. So the alternative is that they're not open at all. So again, we have to find the ways to make all this stuff work so that we can keep businesses viable and open.
As a reminder, a week ago, Orange level 3 actually said all gyms must close. So luckily, in the last week, a lobby of gyms came together based on data, was able to make that change within the level 3. But we need to make sure that we're following the order so that can continue to stay within the level 3, or sorry, the orange high risk level. They just changed all the terminology on us. The orange high risk, so that we can continue to keep our gyms open at a capacity at that level, because none of us wanted to move to orange and have to say, I'm sorry, you have to close down again. So luckily there's that 25% capacity at this point. All right, are there any other questions out there? I know we opened a can of worms with the fan comment. I will try to send out the HVAC webinar. It's by the state air specialist. There are certain filters, and you might be getting contacted by HVAC companies that are promoting certain filters over others. And I think this webinar kind of dispels some of that, especially as we move indoors. Any other questions out there? Again, the move is on. Oh, here we go. See, I ask a question, it comes in. If you have 25 people socially distanced in a room working out individually, that's not considered a group gathering, correct?
Correct.
That's correct. Nobody can, that's
yes,
correct.
Sorry, yes. Yeah.
So the way the webinar, you and I can see each other, but if you're they can only see if you talk. But the personal gathering order, the actual order for gyms, you're going to follow that. The personal gathering order is actually if it's a personal gathering, people,
Yes.
Yep. Okay. So a reminder, digest this information. I will send a follow-up email with the HVAC webinar because I'm just getting a bunch of texts about that. With this or the link to the order, a copy of this webinar, the resources that were mentioned. If you have any additional questions, we will have a 1 o'clock call for all industries on Friday, because On Friday, this goes into effect. So we want people to give the opportunity for you to digest the information, the move, the changes, and to be able to ask your questions at that time. Nobody comes on, that's fine. But we want to provide that opportunity for you to ask your questions this week in a live setting. In the meantime, if there are no more questions, I'm going to thank both of you. This was, you know, a lot came up. I know everything came out at like 2 o'clock, and you guys, you know, had a lot of questions in the last 2 webinars. So I appreciate this.
Thank you.
And I think someone just wrote, thank you for all the work on this. People need to understand you're all just interpreting the guidelines, not establishing, and that people are happy to be open still. And I think that a lot of businesses feel that way. So I appreciate what Boulder County's Public Health is doing to help us to interpret these guidelines, to help businesses stay open. And I'm glad that we can provide these opportunities to answer questions and do what we can to keep those businesses open in some capacity.
Absolutely.
Thank you.
Thank you, Corinne. Thank you, everybody.